since robotic has all the platform in which AI can be incorporated, and ultimately there would be a time when full automation would be achieved in robotics. So, Rehan Saab, this is what the AI is in robotic. So basically, AI is all data hungry application. So you need to have maximum data to be incorporated in the equipment. And when we talk of robotics, so all the robotic, whether we are talking of surgical intuitive or CMR, so they have all the stored data, and for them to interpret the data in form of patient characteristics, intraoperative videos, instrument kinematics, and robotic sensors are there. So there is a huge data, and the only requirement for AI is to have a huge data. And this can be incorporated through artificial intelligence and machine learning. And obviously there are many neural networks are there, LLM language models are there, and with the help of all this data, ultimately we would be in a position to have. Uh, so at one time, this is a surgical education and assessment can be done through the same robotics. There is a great need, and there is a great place to have an intraoperative feedback while we are doing the operations. Intraoperative assistance is always there while we are doing, and ultimately we are going toward a stage of autonomy at which the probably things would go on automatically with the help of robotics. So this is our team. These are our young to very dedicated staff nurses who are always there, who set up the console, and who are there to have a porting, and they always set up the whole scenario before the actually surgeon goes in and sits on the console. So level one in AI is traditional surgery in which there is no automation, and we in all sort of open surgery and laparoscopic surgery we basically operate on a level zero. In level one, there is some sort of assistance, and this is an enhanced intraoperative field. And whenever we talk of 3D laparoscopes and robotics, so we are actually at level one, in which there is an enhanced field, and we can actually see the things with very clarity and with very visibility. In level two, there is partial automation, and there is a reduced level of human input, but human surgeons still need to perform a lot of operations on level 2. In level 3, there is a conditional automation, and this is being utilized in orthopedic, in which the drilling to a pre-specified bone depth is being done by orthopedic people on robot. And level 4 is fully automation, in which the skin closure and lymph node biopsy or lymph node dissection can be carried out with the help of robot. In level 5, what the AI and robotic people are thinking, in which the urgent cholecystectomy can be performed, and most of the automated procedures can be adopted, and ultimately autonomic, and for that purpose the robotic suturing has been executed, and probably it is about to be started. And this only comes with the help of lot of data driven AI, and there are a lot of AI models which are actually playing in making these robots autonomous. So the very one of the most important thing is intraoperative field. So robotic assistance AI models make the intraoperative fields a great, in which you can actually see the surgical planes that are free of vital structures. So there are many LLM models and APM models in which with the help of which we can actually, with the help of robot, we can actually avoid the structures in which there are vessels, nerves, In surgical oncology, tumor-free margins can be attained with the help of AI models when they are utilized for robotic surgery. Talking of urology, while doing a robotic prostatectomy, a very clear tissue plane can be obtained with the help of AI models. Similarly, AI models have been utilized in neurosurgery, in which a lot of data has been taken from the harmonic scalpel, which is used, and ultimately, with the help of data generated with the help of those energy devices, most of the tumors can be taken out, and by avoiding the injury to the normal vital structures. When we talk of surgical enhancement, real time, we are still in autonomy level 1, in which the AI image can be enhanced, and it can be enhanced to 5 times and 10 times. Enhanced identification of anatomical structures. Uh, Image quality can be much enhanced. There are many models, AI models, in which the smoke is evacuated, the vision is highly comes with the clarity, and there are CNN model, which is convolutional neural network, and swim transformer, which handles the smoke at the same time. So smoking and bleeding are one of the very important areas in which the it is difficult to operate. So there are various AI model in which the help of smoke and in bleeding, the surgeon can easily and effectively deal all the problems. If we talk of assessment and feedback, so assessment and feedback is there in simulator and in a real life scenarios, which I am going to show. So there are automatic surgical flow recognition. They are being developed and they are in use. There is a tool user data, how much instruments have been used and for how much hours they have to be used more. Uh, Basically, all these gestures which are being utilized on the console, they are transformed to the robotic arms, and ultimately the things are being carried out. This APM, automated performance matrix, it gives a very objective way of assessing the skills of a surgeon in terms of whether he is a novice or expert. Surgical difficulty measurements are there with the help of AI models in the robotic, and actually we can, as soon as the robotic docking takes place, so with the help of various AI models, we would be in a position to see whether we would be seeing the surgical difficulty or not. And these dry labs and simulator lab and wet labs are one of the, again, very important in AI when we are talking of assessment and feedback. So tactile perception is very important perception, and which is only present in the open surgery, which we can handle the tissues. We actually see the resistance of the various tissues, and these tactile sensations have been lost when we talk of laparoscopic surgery, and practically in robotic surgery, these tactile sensations are not there. So more and more work has been done, and AI models have been developed in which we can actually see the force measurement in the while sitting in the console. We can actually see how much force is being executed on a specific tissue, and there is a real-time haptic feedback, and we are in a position to judge that this much retraction has to be given to the specific tissue, and we cannot overcome that specific retraction force. Okay. So this is how the AI generated data. This is, if you use, this is MWF is my name. This is AI generated over what type of surgeries has been executed. So this data is practically going to a CMR. So ultimately, this data can be interpreted and this can be executed to make a lot of AI. This is how, if we actually see, this is the movement of my hands while sitting on a robot, right arm, left arm, and if you see a chart on left side, so uh, the, the lines above the dotted lines are not so this is a great feedback for me. Okay, these were the kinematics of the instrument which were below the dotted line, and these are the lines which are above the, so this would be give me a great feedback, so that subsequently I have to reduce my hand movements while sitting in console. uh, this is again one of the, what is a surgery time, what is a console time, what is active console time, which is really actually comes on a console, and this is saved on day to day basis. These are the clashes, and if you see the, so the central bar, so these are the clashes which I mostly did it while doing the laparoscopic and incisional hernia, so I had many clashes. So practically this was a feedback to me as to decrease the clashing of the various instruments. So, lastly, there are problems of AI. Data privacy, obviously, anonymous data can be shared, but they cannot be shared by the name of the patient, or there is lot of demographic data which is there. AI works in a black box, but here when we are coming to the patient, so the transparency against come into action. Bias, so bias is always there. uh, there is an involvement of industry, and there is a data, most of the data has been driven by the industry, and we have to actually see what type of bias does happens. Accountability and financial incentives are again one of the important factor while we are considering the use of AI in robotics. So just to conclude, robotic surgeries are the platform. These are practically the only platform where the AI can be used in very near future. Automation of the surgical tasks would be done soon, and these would be done in the best of the patient safety. And automation of the skills assessment tools and feedback are again one of the important part of this AI when we apply these to the robot. And ethical questions are there, and we have to address these ethical questions all the time. Thank you very much. So any question? Madhu?